Centers for Disease Control and the World Health Organization continuing to monitor any new outbreaks of the deadly hantavirus. The close watch is necessary following an outbreak of the virus on a cruise ship on which 3 passengers died and several others were infected, and they're now in quarantine. Marvin Scott is live in the newsroom with the latest. Marvin.
Well, hey, Jay, the number of confirmed and probable cases of hantavirus of those who were aboard that cruise ship is now risen to 11. The 2 people are confirmed to have died from the virus, and there is a 3rd passenger who is believed to have succumbed to it. The ill-fated cruise ship is now on the way back to the Netherlands. While most of the passengers have returned home, more than a dozen others, including 3 New Yorkers, are in quarantine units at the University of Nebraska Medical Center and another facility in Atlanta.
All 18 individuals are still being monitored very closely. That's important because if they do get ill, you want them right near expert health care.
Appearing on the PIX Morning News, New York State Health Commissioner James McDonald said a lengthy quarantine process is necessary because the virus can be highly contagious.
So they have to quarantine for 42 days. That's because the incubation period. And incubation periods, when am I exposed and when could I see symptoms? And so really, that's the problem.
Several states across the country are now closely monitoring people for potential exposure to the virus. Governor Hochul said she's working on a hantavirus response plan if it's needed.
If someone is coming back to New York who is a high-risk contact, it'll be non-commercial transport. Then they'll be transported safely to where they're going to quarantine if that is something that will occur. We also have identified all the hospitals in New York State that can handle a patient like this.
I'm feeling well.
30-year-old Jake Rosemarin of Boston says he's being kept comfortable while in quarantine.
Here's my thermometer for temperature checks during the day. I have a stationary bike for exercise, a recliner, my bed, and a desk.
The state's health commissioner noted that while the potential threat is high, the risk of contracting the virus is not.
The risk isn't very high, but it's there, and that's why person-to-person spread is something that, if you look at what's happened right now, everything's been done to protect everybody from spreading it to each other.
Now, the outbreak on the cruise ship has now been traced to a Dutch couple. They died. They contracted the infection while bird watching that included the stop at an Argentine garbage dump. Right now, there is a country-to-country tracking situation going on to monitor any of the new outbreaks. In the newsroom, I'm Marvin Scott. Jay?